If you're over 70, there's something your doctor might not be telling you. Some of the routine medical tests you've done for years could actually do more harm than good. That sounds strange, right? After all, we've been told for decades that the more we test, the healthier we'll be. But here's the truth. Once you hit your 70s, your body changes. It heals slower, reacts differently, and becomes more sensitive to stress and procedures. A test that made perfect sense at 50 might carry real risks at 75. Like the PSA blood test for prostate cancer. It can lead to a biopsy, then infection, and months of recovery for something that might never have affected your life at all. Or a colonoscopy that used to be easy, but now comes with higher risks from sedation and dehydration. This isn't about ignoring your doctor. It's about asking smarter questions, the kind that protect your health and your independence. The question isn't, should I get tested? It's, will this test help me live better, or just give me more numbers to worry about? In this video, we'll cover 5 common medical tests experts say you should rethink after 70. Not to refuse care, but to make sure every decision truly supports your best years ahead. And at the end, I'll share a free Smart Health checklist, the exact questions to bring to your next appointment. Because after 70, good health isn't about doing more. It's about doing what matters most. Disclaimer: this video is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your healthcare provider about what's right for you. Test number 1, PSA screening, prostate cancer test. For men, one of the most common and most confusing tests after 70 is the PSA blood test. It measures prostate-specific antigen, a protein made by the prostate gland. High levels can sometimes signal prostate cancer, but here's what most people don't know. After 70, the PSA test can often cause more harm than good. Here's why. Most prostate cancers in older men grow very slowly. In many cases, they'll never cause symptoms or shorten your life. But once that PSA number looks high, it can start a chain reaction. Stress and sleepless nights waiting for results. Biopsies that carry risks of bleeding or infection, and sometimes even surgery or radiation that cause long-term side effects, like incontinence or fatigue. All of that for something that might never have caused harm in the first place. That's why the U.S. Preventive Services Task Force does not recommend routine PSA screening for men over 70. The science shows that the risks outweigh the benefits in most cases. Now, this doesn't mean you should ignore prostate health. If you have new or unusual symptoms, like pain, changes in urination, or blood in the urine, always talk to your doctor. But for general screening, it's usually better to pause and ask, would knowing this result actually change how we treat me? Or would it just cause more stress? Your doctor can help you weigh the pros and cons based on your specific health and family history. Remember, after 70, peace of mind comes not from more testing, but from smart decisions. And in many cases, skipping the PSA test means avoiding unnecessary worry and focusing on what truly keeps you healthy. Test number 2, colonoscopy after 75. For decades, colonoscopy has been one of the most trusted tools in preventive health. It helps find and remove polyps before they turn cancerous, and for people in their 50s and 60s, it truly saves lives. But after age 75, the story changes. Here's why. While the benefits of finding new polyps go down, the risks of the procedure go up, especially for older adults. Sedation can cause confusion or dizziness afterward. There's a higher chance of dehydration, bleeding, or even bowel perforation, a tear in the colon that can require surgery. And if your previous colonoscopies have all been normal, your risk of developing colon cancer after 75 is already very low. That's why the American College of Physicians and the U.S. Preventive Services Task Force both recommend stopping routine colonoscopies after 75 for people at average risk. Of course, if you have symptoms, unexplained weight loss, persistent bleeding, or significant changes in bowel habits, that's different. In those cases, your doctor may suggest further evaluation. But for screening alone, less invasive options now exist, like stool tests that can detect early warning signs from the comfort of your home, with no hospital prep or sedation required. The question to ask your doctor: since my last test was normal, is there a safer, simpler option we can use instead? The goal isn't to avoid care, it's to make sure the care you receive fits your stage of life and protects your comfort, not just your colon. Because at 75 and beyond, sometimes the best prevention isn't another test. It's knowing when to stop testing. Test number 3, mammogram after 75. For women, mammograms have long been seen as a routine part of staying healthy, a yearly test to catch breast cancer early. But after age 75, the research becomes less clear. Here's why. While mammograms continue to detect cancers in older women, they don't always improve life expectancy, especially when other health issues are already present. Many of the cancers found at this age are slow-growing, meaning they may never cause symptoms or affect lifespan. But once a mammogram detects something unusual, it often triggers a chain of stressful and invasive procedures, additional imaging biopsies, sometimes even surgery, radiation, or chemotherapy. These treatments can be hard on an aging body and often don't add meaningful years of life, but they can reduce energy, independence, and overall quality of life. That's why many experts, including the American Cancer Society and American College of Physicians, now recommend that screening after 75 should be a personal decision, not an automatic one. If you're healthy and want to continue, that's fine. But if you're dealing with other health challenges or limited mobility, it's equally reasonable to stop. Ask your doctor, if this test finds something, would treatment actually help me live longer or just make me weaker? The answer to that question often makes the path forward much clearer. At this stage of life, your health goals may shift from find everything to focus on feeling well. And that's not giving up. That's being wise. Because living well often means choosing peace over procedures. Test number 4, tight blood sugar control, diabetes management after 70. If you've lived with diabetes for years, you've probably heard the same advice over and over. Keep your blood sugar as low as possible. And while that's important when you're younger, after age 70, that same rule can actually become risky. Here's why. Strict blood sugar control, especially aiming for an HbA1c below 7.0, can lead to hypoglycemia or dangerously low blood sugar. For older adults, that's not just uncomfortable, it can be dangerous. Low blood sugar can cause dizziness, fainting, confusion, or even falls, which can lead to fractures and hospital stays. In fact, studies show that older adults are more likely to be hospitalized for low blood sugar than high blood sugar. That's why the American Diabetes Association, ADA, now recommends more flexible goals for people over 70, usually keeping HbA1c between 7.5 and 8.5, depending on overall health and activity level. Loosening those targets isn't giving up. It's about safety and balance, keeping energy steady, avoiding complications, and maintaining independence. Ask your doctor, what's the safest blood sugar goal for me? Not just the lowest one? This small question can make a big difference, because the truth is, a slightly higher blood sugar level might actually help you feel stronger, more alert, and less at risk for dangerous drops. It's about finding the sweet spot, where you stay healthy, stable, and free from unnecessary stress. Remember, health at 70 isn't about chasing perfect numbers. It's about living comfortably and safely every day. Test number 5, routine CT or PET scans without symptoms. CT and PET scans are powerful diagnostic tools. They can detect tumors, infections, or other changes deep inside the body. But after age 70, getting these scans as part of a routine just to check approach can sometimes cause more harm than good. Here's why. These tests are extremely sensitive. They often pick up small spots or abnormalities that turn out to be harmless, what doctors call incidental findings. But once those are found, they usually trigger a chain of follow-up tests, more scans, biopsies, or even surgeries. And each step carries its own risks, from infection to anesthesia complications, especially for older adults. Studies show that up to 1 in 4 older adults experience some kind of complication after follow-up procedures triggered by incidental scan findings. Yet in most cases, those findings never would have caused a problem in the first place. So what's the smarter approach? Ask your doctor. If this scan finds something, will it actually change how we treat me? Or will we just watch it? That one question helps you separate what's truly necessary from what's just routine. It's also worth remembering that CT scans involve radiation exposure, which adds up over time. That doesn't mean they're unsafe. It just means they should be used thoughtfully when there's a clear reason. If you feel fine and have no symptoms, chances are your time and energy are better spent staying active, eating well, and focusing on things that keep you feeling vibrant. Medical imaging has its place, but at this stage of life, wisdom often means choosing fewer machines and more meaningful moments. Let's take a moment to recap what we've covered so far. The 5 medical tests that most experts say older adults should rethink or question after age 70. 1. PSA test for prostate cancer. Often detects slow-growing issues that may never cause harm. 2nd, colonoscopy. After 75, the risks from sedation and bleeding often outweigh the benefits. 3rd, mammogram. Detects more, but doesn't always extend life, can lead to unnecessary treatments. 4th, tight blood sugar control. Lower isn't always better. Mild flexibility keeps you safer. 5th, routine CT or PET scans. Can trigger unnecessary follow-ups and stress from incidental findings. The message isn't, don't get tested, it's get tested wisely. Ask questions, weigh the risks, and choose what supports your comfort and quality of life. Now, let's look at what does make a big difference for your health after 70. And it has nothing to do with more medical tests. If you're cutting back on unnecessary tests, what should you focus on instead? The answer is simple. The foundations of health that keep your body strong, your mind clear, and your days enjoyable. First, stay active, even in small ways. Movement improves blood flow, muscle strength, and balance, all key for independence. You don't need a gym, a 20-minute walk, some light gardening, or stretching between TV shows all count. Second, eat whole, natural foods. Choose meals rich in color, leafy greens, berries, whole grains, and healthy fats like olive oil or salmon. Add nuts and seeds for zinc, magnesium, and protein. These nutrients support your prostate, heart, and energy. Third, keep your mind engaged. Read, learn, play word games, or share stories with friends. Staying mentally active keeps your memory sharp and your mood steady. Fourth, nurture relationships. Loneliness is one of the biggest health risks after 70. Call a friend, join a community class, or volunteer. Connection is medicine, and it's free. 5. Prioritize rest and hydration. Good sleep heals. Hydration supports every cell. Sip water throughout the day and aim for 7 to 8 hours of rest at night. When you focus on these 5 habits, you give your body the support it needs to thrive without depending on unnecessary medical interventions. Here's the truth most people never hear. Good health after 70 isn't about doing every test. It's about choosing the right ones. The goal of medicine changes with age. When you're young, it's about finding and fixing everything. But after 70, it's about protecting your energy, your independence, and your joy of living. You've just learned about 5 common tests that deserve a second thought. The PSA test, colonoscopy, mammogram, tight blood sugar goals, and routine CT or PET scans. They're not bad tests. They just need the right context. The secret isn't to avoid care, it's to ask smarter questions. Will this test help me live better or just add more stress? What are the real risks for someone my age? Are there simpler, safer options that work just as well? Because when you start asking these questions, something powerful happens. Your healthcare becomes a partnership, not a checklist. Your health decisions should reflect your goals, not just your age. And when you focus on what truly matters, good food, gentle movement, connection, and rest, you're already doing the most important things for a long, meaningful life. If this video helped you feel more confident about your health choices, please click like. It helps this message reach more people your age who need it. And before you go, I've created a free smart health checklist. It lists the 5 tests we talked about, plus the exact questions to bring to your next appointment. Just type health in the comments and I'll send it right away. Because after 70, the smartest thing you can do isn't saying yes to every test. It's saying yes to the life you want to live.